Jo-Dee Brown, nurse at Hotel Dieu Grace Hospital.
Good afternoon. Thank you for joining us all at the virtual Day of Mourning commemoration, April 28th, 2020. My name is Jo-Dee Brown. I'm a registered nurse at Hotel Dieu Grace Healthcare, and I am the bargaining unit president for ONA Local 8. I am also the political action lead. In May of 2019, the World Health Assembly determined that 2020 would be dedicated to a year-long celebration of the nurse and midwife. In doing so, they were highlighting the challenging conditions we all face and encouraged us to advocate for increased investments in nursing and midwifery workforces. In part of the statement, it was said that the world would need 9 million more nurses to achieve universal health coverage by 2030. This dedication was looked at as a once-in-a-generation opportunity to showcase the professions. The designation also coincided with the celebration of Florence Nightingale's 200th birthday on May the 12th. The courageous work of nurses and all healthcare workers does honor to this designation for 2020. Florence would be proud. Sadly, right after the new year began, many areas of the world were already facing the grim reality of the COVID-19 virus's decimation of their local populations. As of the recording of this video, in Canada, there has been 40,190 positive tests done with 1,974 people dying. As of April 18th, it was known that 1,139 of the Canadian total were healthcare workers. It is estimated that 42% of the Canadian cases are healthcare workers and long-term care residents combined. The Ontario healthcare worker number is 1,499, which represents 12.2% of all the cases in the province. Provincially, the Ontario prediction was 1 in 10 healthcare workers would become infected. As of April 20th, more than 100 nurses from around the world have died as a result of contracting COVID-19 in the line of their duties as healthcare providers. The International Council of Nurses predicts that that number is actually higher. The worldwide total, last reported prior to this recording, was 23,000 healthcare workers in over 50 countries were positive. Locally, in Essex County, there have been 525 positive tests with 31 deaths, and 154 of the cases reported are known to be healthcare workers. Of note is the incidence of positive tests in our local long-term care and retirement facilities. Ontario Nurses Association members at Southwood Lakes have had one staff member positive that is now resolved. ONA organized Heron Terrace has 16 staff members that are positive. In the non-ONA facilities in Essex County, Country Village has 26 staff that are positive. Amica has 11 staff that are positive, and Lifestyles has 8 staff, all positive. Some of these are known to have traveled before the pandemic was declared, and others have gained their positives through exposures on the job. Before the pandemic was declared, the Ontario Nurses Association was already attempting to collaborate with the other healthcare unions to effect protocols to protect the health of workers. As early as March 11th, ONA, along with the Ontario Council of Hospital Unions, CUPE, OPSU, and SEIU, called upon the Ontario government for an honest and frank collaboration regarding the guidelines for COVID-19 protection of healthcare workers. Around March 18th, approximately 50 nurses at St. Mary's Hospital in Kitchener were exposed after a patient attended the emergency room, was not screened for COVID but for influenza, who later tested positive, and the staff had not used appropriate PPE. They did not have access to the N95 masks required for some of the procedures used on that patient. On March 20th, a weakened set of guidelines was released by the Ontario Ministry of Health and Chief Medical Officer of Health, Dr. Williams. Directives for self-isolation practices for healthcare workers who had traveled were included. The ministry left the return-to-work decisions to individual employers based on the ability to deem critical staff who then no longer were required to follow the provincial self-quarantine rulings. This allowed employees who had traveled out of the country to return to work directly, as hundreds of other citizens were forced to stay home for 14 days in quarantine. The very people that the public were relying on to keep them well, safe, and healthy were not being identified in terms of being potential carriers or asymptomatic themselves. This included nurses who were working in Michigan and in Windsor and working both jobs during that time. Shortly after the COVID crisis started in Ontario, the Haldimand Norfolk Health Unit laid off public health nurses who have valued and essential positions, especially during this time of public health care crisis. They are much needed in their community. Just last week, ONA has filed a number of court injunctions against privately owned long-term care homes for failing to provide minimum essential PPE to the nurses. The homes named so far are Henley Place in London, owned by Primacare Company, Anson Place in Hagersville, Hawthorne Place in North York, and Eatonville Homes in Etobicoke, all owned by the same company, Rika Care Centers. At this time, I wish to recognize the 2 Ontario healthcare workers who have died from COVID-19. An unnamed man, 58 years old, who worked as an environmental services person at the Brampton Civic Hospital was the first healthcare worker to die from the virus. And most recently, Christine Mandagarian, a PSW in her 50s, also has died. She worked at the Sienna Ultimo Care community in Scarborough. Next year, when we recognize those who have gone before us in the course of doing their employment, let us hope and pray that we are not remembering any local healthcare workers who have succumbed to COVID-19. I want to take a moment to recognize our 3 Canadian healthcare workers who died in 2003 during the SARS epidemic. ONA members Nelia LaRoso, RN, who worked at North York General Hospital, and Tekla Lynn, RN, who worked at West Park Health Care Center, both selflessly cared directly for SARS patients infected. They became infected themselves and succumbed to their illnesses. Dr. Nestor Yanga was a physician who worked in a large Toronto family practice. At that time, 169 of the 375 who were diagnosed with SARS were healthcare workers. In the Greater Toronto Area, a total of 44 people died, hitting in 2 separate waves. Chief Justice Archie Campbell headed a commission into the entire handling of the SARS situation, and he left recommendations that should have never left Canada standing with their pants down in January 2020 when the first case was noted in Canada. I also want to include in our remembrances those who sadly lost their lives in the senseless, murderous attacks in Nova Scotia last weekend. People from many walks of life were included in this attack. However, we would like to note, acknowledge, and remember the 2 VON healthcare workers who lost their lives in this shooting. Heather O'Brien, licensed practical nurse, and Kristen Beaton, continuing care assistant, both employed by the VON. And also remembered is a recently retired healthcare worker from Ontario named Dawn Madsen. She worked at the Hillsdale Terrace home in Ontario and had just recently moved to Nova Scotia last year. ONA continues in partnership with the Canadian Federation of Nurses Union to lobby the federal government for changes to the criminal code and statutes related to violent acts against healthcare workers. Violent incidents caused lost time injuries have increased by 27% over a 4-year span, 2013 to 2016. Healthcare workers are 4 times more likely to be the target of workplace violence than any other professional, according to the federal government's Standing Committee on Health. We remember, as we will not forget, the senseless death of Lori DuPont, our ONA sister and colleague and friend to many. There is no place for acts of violence in healthcare settings. In closing, I wish to acknowledge the guidance and support from Erna Buena, Occupational Health and Safety Specialist from Ontario Nurses Association, who has provided a great deal of her time and resources to work with myself and the leadership team at Hotel Dieu Grace Healthcare to make us one of the safest hospitals in Ontario and attaining national recognition for workplace violence safety excellence. Thank you all. Stay safe and work safe.